You hear a researcher called Dr. Sarah James giving a presentation on the subject of weight loss interventions by GPs. You now have 90 seconds to look at the questions.
My name's Dr. Sarah Jones. Today I'm going to be talking about brief interventions for weight loss. What that basically means is helping patients to get started on the road to losing weight, and I'll be introducing you to some exciting new work on the subject. I've been interested in obesity for a long time, and it's an issue that matters. 2/3 of adults in this country are overweight or obese. So I absolutely recognise that we need interventions which can be part of routine care. The reality is, however, that relatively few practitioners actually make such interventions, despite the fact that this is an established part of clinical guidelines in many parts of the world. Now, why is that? One reason, I think, is that they tend to have an attitude that goes, "What can I really achieve in a brief intervention?" Now, that's a reasonable concern. But when we did a review of weight management services led by health professionals, there were so few of them that it was difficult to know whether or not they made much difference. As a result, we decided to do our own trial, which we called Brief Interventions for Weight Loss. What we did was train GPs to make a very brief 30-second intervention with every patient coming into their routine clinics who had a BMI greater than 30. Basically a brief chat saying, "While you're here, have you thought about the benefits of losing some weight?" The reason for doing this was to get patients who weren't really thinking about their weight to focus on it for a moment. If the doctor raises the issue in this way, we can capitalise on that heightened awareness by offering them support. By referring them to a program, we can create lasting motivation to lose weight. So, that was the theory. How did it work out? What I'm going to say next should provide huge reassurance to practitioners. Our first step was to conduct a survey of 500 likely candidates for the trial. Although weight remains a very delicate personal issue in the public domain, only a tiny proportion of those surveyed thought it was inappropriate for their doctor to discuss weight loss on a professional basis. Given the need for urgent action on the issue, I think that's a pretty strong mandate. Anyway, as I said, this was a trial, so there were two groups of patients. With patients in the first group, the doctor formally raised the issue of weight and offered a referral to a weight management program. For patients in the other group, which was the control group, the doctor simply said, "It would be good for your health if you lost some weight." So what happened when this weight loss intervention was trialled? Well, the answer is that 3/4 of those offered referrals said, "Yes, doctor, I'd like to do that." That was an excellent start, but we're realists. and of course, they didn't actually all turn up. But nonetheless, a large number did. Of those who accepted the referral, more than half attended the program. Now, that's a fantastic result, exceeding our expectations, and indeed most of them completed it. So given that it was a completely unselected, totally opportunistic intervention, we were quite encouraged at the uptake for this program. But of course the crunch is, what happened to their weight? Well, at 3 months, people in both groups had lost weight. The control group, you remember they'd simply been advised to lose weight but were left to their own devices in terms of what they did about it. Now, they'd lost 1.75 kilos on average. Meanwhile, the group attending a weight management program had lost significantly more, about 3 kilos. When we followed both groups up again at 12 months, patients in both remained below their baseline weight. But the intervention group had again done significantly better than those people left to manage their weight independently. This is an interesting trial because it allows us to model what the effect would be if GPs made this kind of brief intervention more widely, just once a year for each eligible patient. So, how scalable are the results? By 2035, run countrywide, such an approach could reduce the prevalence of obesity by half. That's a dramatic result, showing that these brief interventions not only help individuals, but could also lead to huge gains for everyone in terms of better health and reduced healthcare costs alone. So, to sum up, I guess what I want to convey to you is that brief, opportunistic interventions from a doctor to encourage weight loss, when made in a supportive manner, are really to be encouraged. Thank you.